Hi, this is Dr. Cernik. There's 42 million Americans right now living with untreated hearing loss. 6 out of 10 folks with diagnosed hearing loss do not know what is causing their challenge. My role, my job, is to find the why behind that. It is not as simple as age. Most people will say, I'm older, I have hearing loss, but not necessarily. I recommend a baseline hearing test at age 50 for this reason. Most of us, as we get older, have at least one of these variables that we're about to talk about. So what does cause hearing loss? We know there's a link to falling. We know there's a link to cognitive decline, but there are 4 systemic variables which correlate to hearing challenges. Diabetes. Being diabetic, your risk goes up. But what happens with the lack of blood supply to the inner ear, those with diabetes under the age of 65 are 2 times more likely to develop hearing loss. Cardiovascular disease. In particular, 85% of identifiable stroke patients have low-frequency hearing loss. High blood glucose levels correlate to hearing loss. The last largest in the news now is the cognitive and dementia aspect of it. Hearing loss over time changes the volume of our brain. When there's hearing loss, the brain does not get proper stimulation, and the consequence, if untreated, is that there is a 200 to 500% increased likelihood of developing cognitive decline with hearing loss. Kidney disease, thyroid disease are the other 2. So if you have any of these variables, that in itself is reason enough for you or a loved one to be checked. We're the Hearing Assessment Center.